Now, the time has come to officially close this summit, the virtual edition, where we have, of course, missed not meeting face-to-face in Boston. We have also missed the wonderful hospitality of the 2021 summit's hosts, the American Society for Clinical Pathology. So here is the Chief Executive Officer of the American Society for Clinical Pathology, Dr. Blair Holladay.
The American Society for Clinical Pathology includes as part of its mission a focus on working with other organizations to facilitate and advance high-quality patient care. Collaboration, while often seen as a trend, is part of who we are. It is ingrained in the ASCP, an integral part of our way of life. We have seen firsthand that the only way to solve the global challenges cancer inflicts on populations and communities across the world is through collaboration. The cancer care continuum includes dozens of required personnel and resources, in time and in sequence, to guide a patient through their journey. And patients are at the center of everything we do at ASCP. As the leader in laboratory diagnostics, ASCP works directly with every major laboratory organization in the United States and many abroad, across a range of initiatives and programs centered on education, certification, advocacy, and global outreach. Quality, safety, efficiency, and best outcomes for the patient are at the forefront of everything we do and are the metrics we capture to prove our success. In 2015, under the Obama White House, ASCP launched the Partners for Cancer Diagnostics and Treatment in Africa, an initiative that ramped up Vice President Biden's Cancer Moonshot initiative. The Partners program brings rapid, accurate pathology diagnosis to low and middle-income countries through capacity building, telepathology, training, and member volunteerism. And today, we are active in more than 20 countries, including 15 with telepathology access serving hundreds of millions of patients. But Partners is not just ASCP. It's success to the thanks of dozens of organizations that work with us, including BioVentures for Global Health, the Clinton Health Access Initiative, the American Cancer Society, Pathologists Overseas, the Max Foundation, along with dozens of US-based academic institutions and dozens of industry partners. The totality of this collaboration is in direct contact and coordination with the World Health Organization, the Centers for Disease Control, the National Institutes of Health, and many other governmental and non-governmental groups. ASCP's collaboration efforts are not limited to the Partners Initiative. Recently, we are a founding member, along with dozens of other organizations, for the Coalition for Implementation Science Research in Global Oncology, known as CIRGO. The mission of CIRGO is to connect funders with investigators in African countries that have identified actual gaps in the implementation of cancer care, for which data collection is needed to prove any solution effective. The ASCP Partners Initiatives implements what we know works, and our work with CIRGO complements that approach by testing out the aspects of cancer care for which we still need feasible solutions. The synergy of these two programs allows us to provide expertise in cancer care across the continuum and fosters sustainable collaboration among the organizations that are best poised to rise to the challenges of cancer care. The World Cancer Leaders Summit is the penultimate expression of the value and impact of collaboration. The past several days of direct, constant networking, discussions and interactions, which follow more than a month of vibrant online community interactions, have refreshed and renewed our organization's vigor around efforts to defeat cancer wherever it is. This year's summit showcased the important role of diagnostics for cancer on numerous panels. Cancer diagnostics are crucial for every patient with suspected cancer, and we are grateful to the Union for International Cancer Control and all of our attendees for recognizing and understanding the critical role they play and bringing diagnostic knowledge and innovation to the forefront. As we move into the third decade of the new millennium, it's thrilling to see how far we have come in technology and medicine and connectivity Yet heartbreaking that there are billions of people who suffer and die from highly treatable and curable diseases like cancer. The focus can no longer be the lack of solutions because of funding or feasibility or sustainability. Rather, our focus must be on solving problems on an accelerated timeline through collaboration, cost efficiency planning, and building health systems. And we at ASCP have been proud to participate in the 2021 World Cancer Leader Summit and look forward to continuing to work with you and meet your needs and hopefully exceed the needs of our patients around the world.
Thank you very much indeed, Dr. Holladay, and thank you also to all of your team for their hard work on this summit. Good luck as well in your annual meeting in Boston. We go back now to UICC President Dr. Anil to officially close this summit and reflect, of course, on the 2021 edition.
And now the difficult task falls on me to try and close these 2 days of virtual discussions. I walk away from my computer screen feeling inspired and reassured that the innovations out there have a real potential to advance cancer control in an equitable manner. And as we have heard, this is already happening. We heard some fantastic examples from across the world on how digital solutions transform the delivery of care, how big data can help us address equity challenges, and how the new forms of media are being increasingly used for cancer information and communication. We talked about the need to invest in cancer research and address the current pandemic, its consequences, and a way forward for the cancer community. Although we did not manage to meet this time in person, I saw plenty of networking opportunities, interactions, some very interesting discussions taking place on the summit platform. If you missed some of the sessions, please be assured they are available for you on demand on the platform until the end of the year. I'd like to acknowledge the new cohort of young leaders, committed young professionals with diverse backgrounds presented to you at the beginning of the summit. Please try to get to know them. Who knows how many of future innovators this group consists of? Of course, I'd like to thank once again our hosts, the American Society of Clinical Pathology, for their intense dedication, engagement, and fruitful collaboration. Although we couldn't meet in Boston due to the travel ban, the ASCP understood and supported the decision to go fully virtual and remain truly committed and engaged in the development of this summit. I'd like to express our sincere thanks also to our long-standing UN partners, the World Health Organization, the International Agency for Research on Cancer, and the International Atomic Energy Agency, who has always supported us in developing the agenda of the summit. Special thanks must also go out to our Summit Platinum and Gold sponsors, without whom this year's summit would not be possible: the US National Cancer Institute, Pfizer, and Sanofi. A special thank you to all my colleagues on the UICC Board of Directors and the UICC Geneva team led by our CEO, Carrie Adams. And thanks to each one of you who engaged with the program of the summit in the lead up to the event and during the past 2 days. We were delighted to have you participate. I'm pleased to announce that we are working with the Journal of Clinical Global Oncology on a special collection of articles related to the summit theme. If you are interested, and I urge you to submit a paper for the collection, please visit our website for details. We are planning to launch the collection at the World Cancer Congress next year. Our next World Cancer Leaders Summit will take place in 2023, as we have decided to alternate between the Congress and the Summit each year. I look forward to meeting you all in person at the World Cancer Congress in Geneva in October 2022. Please note that the call for sessions for the Congress is now open, and we are looking forward to your proposal submissions until the 12th of November. I hope to see you all in Geneva next October. Thank you once again, and take care.
And thank you, Dr. De Cruz. Now, it has been a great pleasure for me to be your host in the Geneva studio for this first virtual edition of the World Cancer Leaders Summit. We have had more than 600 participants connected over the last 2 days, representing nearly 100 countries globally. I hope you have made many connections with other leaders and that you've enjoyed this year's summit discussions on driving innovations to advance cancer control equitably. Thank you so much also for your interaction with all the speakers and for submitting so many questions. All the sessions, of course, will be available to watch on demand in the digital library of the Summit platform for up to 3 months.